116 million. That is the number of American adults currently living with diabetes or prediabetes. And the vast majority have been told the same thing: cut the carbohydrates, take this medication, come back in 3 months. Nobody explained what is actually happening inside their cells. Nobody told them that the fastest way to fix blood sugar is not about removing entire food groups. Nobody explained that adding specific foods in specific combinations can begin lowering blood sugar faster than most people believe possible. My name is Dr. James Carter. For over 2 decades, I have worked exclusively with senior patients managing cardiovascular disease and complex metabolic conditions. And high blood sugar is one of the most consistent topics I address, because the connection between blood sugar dysregulation and cardiovascular disease in seniors over 60 is not just correlated. Every point of sustained elevated blood sugar is simultaneously damaging your arterial walls, your kidney filtration system, your retinal blood vessels, and the nerve endings in your feet. The cardiovascular consequences of unmanaged blood sugar in seniors are not future concerns. They are happening right now in real time. Subscribe right now and hit the bell. Every week I publish health information your last 3 appointments never covered. Hit the like button and type your morning fasting blood sugar reading in the comments right now. Just the number. I read every single comment personally. Before the 10 foods, a patient whose case made this topic impossible to approach without complete urgency. A senior came to see me several years ago, 68 years old. Frightened, fasting blood sugar consistently around 178. Their doctor had just recommended a second medication. They had watched a parent lose a foot, then their vision to the same disease. They did not want to spend the rest of their life climbing the medication ladder. We did not remove carbohydrates. We added 10 specific foods over 3 weeks. Within the first week, fasting numbers began dropping. Within 12 weeks, working alongside their physician, they came off the second medication entirely. Their A1C moved from the diabetic range back toward normal. 2 years later, it has held. Not because of willpower, not because of deprivation, because specific foods were addressing the specific biological mechanism that no medication was designed to reverse. That mechanism is insulin resistance. High blood sugar almost always starts with insulin, the hormone that unlocks your cells so glucose can leave your bloodstream and enter the cell where it belongs as fuel. When you have spent years on the blood sugar roller coaster, your cells stop responding. The key keeps arriving, but the lock no longer turns. Your pancreas pumps out more and more insulin trying to compensate. Blood sugar climbs anyway. And the standard response is a prescription pushing even more insulin into a system already overwhelmed, managing the number without addressing the cellular dysfunction underneath. Every food on this list does one of 3 jobs. It slows the glucose coming in. It cools the inflammation, jamming the insulin signal at the cell surface. Or it directly restores insulin receptor sensitivity, so your own body does the work it was designed to do. Add them progressively over 2 to 3 weeks. The cumulative effect is significantly greater than any single food produces alone. Food 1. Fenugreek seeds. Small amber-colored seeds available in the spice aisle for approximately $2. Fenugreek is packed with a soluble fiber called galactominin that swells into a thick gel in your stomach, physically slowing how fast carbohydrates pass into your small intestine. Slower emptying means glucose trickles into your blood rather than flooding it. No flood means no panic insulin response. Fenugreek also contains an amino acid that directly stimulates pancreatic beta cells to release insulin more efficiently and improves muscle cell glucose uptake independently of insulin signaling. A 2022 study in Nutrients found fenugreek supplementation produced statistically significant reductions in fasting and postprandial glucose over 12 weeks. Preparation: soak 1 teaspoon of whole seeds in water overnight. Drink the water and eat the seeds before breakfast. If the bitter taste challenges you, grind half a teaspoon into yogurt or over eggs. Food 2. Ceylon cinnamon. You likely have cinnamon in your kitchen, but the variety matters. Common grocery cinnamon is cassia. It contains coumarin that can be hard on the liver in daily doses. The one you want is Ceylon cinnamon, true cinnamon, which is safer for daily use and contains higher concentrations of the active polyphenols that mimic insulin activity at the cell receptor level. A 2023 meta-analysis in Nutrition Reviews confirms cinnamon significantly reduced fasting glucose, postprandial glucose, and insulin resistance markers, with the strongest effects in adults over 55. Preparation: 1/4 to half a teaspoon of Ceylon cinnamon daily in coffee or oatmeal. Pair with a carbohydrate meal. That is exactly when you want insulin receptors gripping harder. Did you know the difference between Ceylon and cassia cinnamon before today? Type "knew this" or "had no idea" in the comments right now. Food 3. Broccoli sprouts. Not full-grown broccoli. The 3-day-old sprouts contain sulforaphane in concentrations 50 to 100 times higher than mature broccoli. Sulforaphane does something none of the other foods do as directly. It goes to your liver and reduces overnight glucose production. Your liver manufactures glucose while you sleep. In insulin resistance, it produces far too much, which is exactly why many seniors wake up with a high fasting number, despite not having eaten for 8 hours. This is the dawn phenomenon. A 2017 Lund University study found concentrated sulforaphane produced measurable fasting glucose reductions, with the strongest effect in patients whose blood sugar was hardest to control. Preparation: 1/4 cup of raw broccoli sprouts on a salad or sandwich most days. Do not cook at high heat. It destroys the active compound. Food 4. Avocado. Most seniors avoid avocado because of caloric concerns. That avoidance is costing them a powerful blood sugar tool. The monounsaturated fat and soluble fiber in avocado slow your entire meal down. Adding half an avocado to any carbohydrate-containing meal places a biological brake on the rate at which it converts to blood glucose, producing a gradual, steady rise instead of a sharp spike. A 2023 Journal of Nutrition study found daily avocado consumption produced significant improvements in insulin sensitivity and postprandial glucose response. Preparation: half an avocado daily. On eggs, mashed onto whole grain toast, added to any meal containing a starch. Anywhere you have a carbohydrate, avocado softens the impact. Food 5. Chia seeds. Chia forms the same thick viscous gel as fenugreek when it contacts water in your stomach, wrapping around meal carbohydrates and slowing their absorption to a controlled, measured pace. Chia also contains plant omega-3 fatty acids that independently reduce the chronic low-grade inflammation, jamming the insulin signal at the cell surface. A 2022 nutrient study found chia supplementation produced significant reductions in postprandial glucose and insulin resistance markers over 12 weeks. Preparation: 1 to 2 tablespoons daily in yogurt, a smoothie, or water with lemon. Give it 10 minutes to gel before consuming. Of the 5 foods covered so far, how many are currently part of your regular weekly diet? Type the number in the comments, 0 through 5, because that number tells me exactly where your biggest immediate opportunity is. Food 6. Fatty fish. Salmon, mackerel, sardines. This food does not slow glucose absorption. It works on the deeper problem: why your cells became insulin resistant in the first place. Insulin resistance is driven significantly by chronic systemic inflammation. EPA and DHA, the long-chain omega-3 fatty acids in fatty fish, are among the most powerful natural anti-inflammatory compounds we know of. They reduce the inflammatory markers that most directly interfere with insulin receptor signaling. The cell membrane becomes healthier. The receptor begins functioning as designed. A 2023 diabetes care study found twice-weekly fatty fish consumption produced significant improvements in insulin sensitivity and fasting blood glucose over 16 weeks, with simultaneous reductions in triglycerides and blood pressure. Preparation: 2 palm-sized servings per week. Baked, grilled, or canned. Canned mackerel and sardines are among the most affordable, nutrient-dense foods in any grocery store. Food 7. Walnuts. Walnuts address both the cellular mechanism and the vascular consequences of insulin resistance simultaneously. The polyunsaturated fat improves endothelial function, the thin vessel lining that chronically elevated blood sugar damages first. The fat-fiber-protein combination blunts postprandial glucose rise and reduces fasting insulin levels. A 2022 meta-analysis in Diabetes and Metabolism found walnut consumption produced statistically significant reductions in fasting glucose, postprandial glucose, and insulin resistance markers. Preparation: a quarter cup or 7 to 10 whole walnuts daily, raw or dry roasted. Replace a processed snack, not add on top of one. Food 8. Whole eggs. For years, seniors were warned away from egg yolks. That advice pushed people toward sugary cereals, dramatically worse for blood sugar than any egg. A whole egg contains almost no carbohydrate, producing virtually no blood sugar response on its own. But the real power is the second meal effect. Starting your day with whole eggs stabilizes blood sugar not just at breakfast, but all the way through to lunch. You arrive at your next meal with calmer baseline glucose and a smaller spike. A 2023 American Journal of Clinical Nutrition study found replacing a high-carbohydrate breakfast with whole eggs produced significant reductions in postprandial glucose and fasting insulin, with effects accumulating over 12 weeks. Preparation: 2 to 3 whole eggs in the morning. Add the avocado from Food 4 on top, and you have built one of the most blood sugar protective breakfasts available from common, affordable, everyday ingredients. Food 9. Apple cider vinegar. The fastest visible measurable effect on a glucose meter of anything on this list. If you have a meter, you can watch this work tonight. Acetic acid, the active compound, slows gastric emptying and independently enhances muscle cell glucose uptake, helping your muscles pull glucose out of circulation regardless of the insulin signal. Research by Dr. Carol Johnston at Arizona State University found 1 tablespoon before a carbohydrate meal lowered the postprandial spike by 20 to 30% in adults with insulin resistance. A 2023 BMC Complementary Medicine meta-analysis confirmed apple cider vinegar consistently reduced fasting and postprandial glucose across multiple controlled trials. Preparation: 1 tablespoon diluted in a full glass of water 10 to 15 minutes before a carbohydrate meal. Always dilute, never drink straight. If you take blood sugar medication, discuss with your physician first. The combined effect can lower glucose faster than your dose was calibrated for. Food 10. Lentils. This food proves the entire point of this video. Lentils are a carbohydrate, and they will lower your blood sugar. Lentils are built from resisted starch wrapped in soluble fiber combined with plant protein, a triple combination that releases glucose slowly and steadily over hours. They also carry the second meal effect. A 2022 Journal of Nutrition study found substituting lentils for white rice or white potato produced significant reductions in postprandial glucose, with measurably lower blood sugar readings for up to 5 hours after the lentil meal. Preparation: half a cup to 1 cup, cooked 2 to 3 times per week. In soup, stew, or a cold salad with olive oil and a splash of the apple cider vinegar from Food 9. Before the action plan, a safety warning I must state clearly. If you take insulin or a sulfonylurea medication, such as glipizide or glimepiride, these foods can lower blood sugar fast enough that your existing dose may become too high, pushing glucose into a dangerous low. Add these foods with your physician monitoring your numbers. Bring this list to your next appointment. Do not stop any prescription independently. Here is exactly what to do tonight. 6 steps starting today. Step 1. Soak 1 teaspoon of fenugreek seeds in water tonight. Drink it first thing tomorrow morning. Step 2. Tomorrow morning, replace cereal or toast with 2 to 3 whole eggs and half an avocado. That single swap changes your blood sugar trajectory for the entire day. Step 3. Buy Ceylon cinnamon, not cassia, and start a quarter teaspoon daily in your coffee or oatmeal. Step 4. Before your largest carbohydrate meal tomorrow, take 1 tablespoon of apple cider vinegar diluted in a full glass of water 15 minutes beforehand. Step 5. This week, swap white rice or white potato for lentils at least twice and add fatty fish 2 evenings. Step 6. Add 1 tablespoon of chia seeds to your morning routine and keep walnuts as your afternoon snack instead of any processed alternative. Let me bring everything together simply and permanently. Fenugreek and chia physically slow glucose absorption. Salmon, mackerel, and walnuts cool the inflammation driving resistance. Ceylon cinnamon and apple cider vinegar restore receptor sensitivity directly. Broccoli sprouts address the liver's overnight glucose overproduction. Avocado slows every meal it accompanies. Lentils prove not all carbohydrates behave the same way. Stack them over 2 weeks, and your cells begin opening to insulin on the first knock again. Your pancreas stops straining. Your fasting numbers start moving. And unlike medication, the improvement addresses the cause rather than managing the number. 3 things in the comments before you leave. Your morning fasting blood sugar reading right now. Which of the 10 foods you are committing to adding first? Type the food name. And type 30-day challenge if you are committing to adding all 10 foods progressively over the next 30 days and coming back to report your results. Share this video with every senior you know who has been told to just cut carbs and take this pill. I am Dr. James Carter. Your cells were never broken. They were starving for the right signals. Starting tonight, give them exactly that.